Okay, hi, my name is Linda Rodriguez. This is my patient, Cesar Rodriguez. I'm going to do the abdominal assessment today, and I just washed my hands, and I put on gloves, and my patient is, for the purpose of this video, he stays dressed. So I'm going to start off with a couple of questions. Cesar, has there been any changes in your bowel movements?
No.
Have you had any pain?
No.
Okay. And so basically I'm going to start off by a general assessment of the abdomen. I'm going to note the overall skin color. And also, before my patient lays down, I would ask him to make sure that he has voided, because it makes the abdominal assessment much more comfortable and the organs are much more easily accessible. So I'm going to note for any surface characteristics, any lesions, any scars. I'm going to note the contour of the abdomen. It should be rounded, flat, or scaphoid, and also the umbilicus should be round, or it can be slightly protruded, which is also okay. I'm going to note for the symmetry of the abdomen. This is best done by going behind the patient, which is right now not possible, but I'm going to pretend I'm going behind the patient, and I'm going to ask my patient to breathe in and breathe out. And I should note for any muscle separations, any masses, any hernias, or any surface motion that from peristalsis. So first I'm going to start off by auscultation. The reason why we start off with auscultation is because the reason is not to stimulate the intestines with any palpation or percussion before we auscultate. So I'm going to auscultate in all four quadrants. The bowel sounds should be from 5 to 35 sounds per minute. And I'm going to start off in the left lower quadrant. Next, I'm going to also auscultate the epigastric area over the aorta, the renal and iliac and femoral arteries. I'm going to note for any venous hum, or I should feel a bruit, and I should feel a bruit. Now I'm going to move on to percussion. It's going to be the same format as in auscultation, starting off with the left lower quadrant. And I'm going to listen for any dullness over the solid organs, such as the liver and the pancreas. Next, I'm going to percuss over the liver to assess the span of the liver. The span of the liver is usually 6 to 7 centimeters. And so basically I'm going to listen for a change in sounds. It should change from a tympanic area to an area of dullness. And once it changes to dullness, I'm going to mark that point. Coming from the top and one from the bottom, so that should be the liver span. going to mark that point. So this should be your liver span. It should be 6 to 7 centimeters. I'm going to do the same on the other side for the spleen. Next, I'm going to move on to palpation. I'm going to start off with light palpation. Light palpation should not be more than 1 inch deep. I'm going to note for any masses or pulsations. They should be relatively comfortable for the patient. Now I'm going to move on to deep palpations, which you can use both hands. It should be much deeper. It should be slightly uncomfortable for the patient. I'm also going to note for any masses or any tenderness. Lastly, I'm going to palpate the spleen, liver, spleen, and kidneys. For this, the liver on the right side of the patient. I'm going to press down, kind of move up into the rib cage. You should feel the liver. And on the left side, I'm going to ask my patient to breathe in and breathe out. Now to assess the kidneys, I'm going to have one hand underneath the patient's back. I'm going to ask the patient to move and to breathe in, press down and breathe out, and the kidney should feel the kidney right in place. Now the same thing on the other side. Breathe in. Now the left kidney is usually less palpable. Lastly, I'm going to assess for any abdominal reflexes, starting from the umbilicus, from the middle of the abdomen. I'm going to try it out to each side, all 4 quadrants, and you should see a reaction from the patient on the abdomen where you're using the pen. If the patient doesn't react, this is an abnormal sign. And this would conclude my abdominal assessment.